Dr. Nabarro, I want to come to the point that Tom Tugendhat raised about China in a moment, but can we just start with the Delta variant?
Yes.
And what we call the Indian variant. How worried are you?
Well, of course. By the way, hello, Trevor, and thank you for the opportunity to hear the interview just now. I know what you're going to ask me in a second. I just wanted to say, yes, all variants that are being looked at right now that are identified as variants of concern are just that. They're variants that collectively we are concerned about, and they are the variants that have either greater transmission capacity or the ability to cause worse disease, and all of them are ones that everybody needs to focus on. But there will continue to be variants emerging with this virus at intervals in the foreseeable future. So we shouldn't be surprised by variants. They are to be expected. That's par for the course.
So is it the WHO's view, really, that we are into a world in which suppression of infection to zero is impossible and a pointless aim, and that what we really need to do is to learn how to live with this thing?
Well, you said it, and I would like to stress to you that humanity is going to have to learn how to coexist with this virus, preventing it from spiking and then surging and causing hotspots of disease. And we're going to have to be able to do this for the foreseeable future. Eradication is not currently a reasonable target for the world.
One signal of that choice would be an approach to international travel. From what you've said, it sounds like you think, actually, we should return to international travel with fewer limitations sooner rather than later.
Well, like everybody, I want life to start working properly, as they say. I want particularly poorer people to be able to get their incomes back. And I want countries to be able to redevelop their economies, and so does the whole of the World Health Organization. So our approach when working with governments is to encourage them to find ways quickly to work together on things like international travel, as well as on things like the sharing of vaccines, with a global plan. We do think that countries working separately when trying to deal with a worldwide threat is not the most efficient way in which to be doing things right now.
Understood. I've asked you about the Indian variant.
Yes.
Of course, this week we've seen something new, Nepal. And we don't have a lot of information about that yet, but it's thought, I think, to be potentially even more transmissible, possibly more lethal than anything we've seen so far. Any signs from the WHO's data that could tell us more?
It always takes a number of weeks after there is a sudden surge and thoughts perhaps that a new variant has appeared to confirm whether or not this is in fact a variant of concern. There's a group that meets and reviews the data, as you would expect. And so they've looked at the Delta variant, the one that was first reported from India. But as you say, there are reports of an additional variant coming from Nepal, and those will be examined in the coming days and weeks, and then we'll know. But each time there is a sudden surge, it does stimulate in one's mind the thought that there might be a new variant appearing. That wouldn't be surprising. And as I said just now, that's the pattern for the future, Trevor. This virus isn't going away anytime soon. There will be variants emerging. Sometimes we're worried that they're going to be able to break past the defense from the vaccines that have been so brilliantly administered. But we're going to have to work together on it. I describe it as being COVID ready, being ready for whatever this virus might bring.
Are you welcoming the Prime Minister's ambition to vaccinate the whole world by the end of 2022? And more importantly, do you think it's realistic?
Well, I was absolutely delighted to read that. You see, we've always said it's going to take some time for the world to be vaccinated, but for the leader of the UK and also the chair of the G77 to put a date on it is wonderful, because this now means that there's a real prospect that when G7 leaders meet next weekend, they will actually think of a plan for getting towards everybody being vaccinated by the end of 2022. And that would change things, because we'll start saying to each other, how do we use this wonderful gift of the vaccines that are available as well as possible to help the world get ahead of this pandemic, rather than focusing on the interests of individual nations?
One of the prerequisites for all of that to happen is trust between nations and between leaders.
Yeah.
Now, let's talk about China. Last February, the WHO more or less absolved China, said it was unlikely that the virus had come out of a Chinese laboratory or indeed out of Wuhan. Does WHO owe the world an apology on that?
Oh, gosh. I mean, I think all of us who work in the issue of this pandemic need to be constantly apologizing, because the fact that this pandemic is causing so much suffering is something that is a great distress, and the damage being caused to the world is huge. And people like myself who've worked on pandemic preparedness for something like 2 or 3 decades really have a huge responsibility. Why couldn't we get the world to be better prepared? Now, when it comes to working with nations on dealing with the pandemic, as you probably know, and I'd just like to stress it for everybody else, the World Health Organization isn't some kind of independent superpower that can just choose to do what it likes, where it likes. It has to work within the rules set by the governments that own it. We are owned by all the nations of the world.
But it has to work with science, though, doesn't it?
Of course. So we are, on the one hand, trying to do everything possible to be as straight and science-based as we can. But at the same time, we have to decide where we work and how we work, always trying to make sure that the countries that we work with approve of what we're doing. We don't have carte blanche, Trevor, and I want to stress that. We do what we're able to do.
Isn't that the outcome of that, though, Dr. Nabarro? And
Yes.
This is not a personal point at all.
Of course.
Isn't the outcome of that the nations that are ready to put pressure on the WHO, political pressure, and China is first and foremost amongst them, get their way, and also they get an easy ride when it comes to investigation, for example?
Well, I hope not. I mean, I don't actually think that anybody is saying that any one nation gets let off when it comes to trying to understand what's happening about this pandemic. For example, when we're dealing with pandemics, it's a joint effort between national governments and the WHO. We are mutually dependent on each other, and no nation is let off the hook. And Trevor, inside the WHO, you've got scientists who just want to do the best science in the world, and all they do all the time is to push at countries when countries are somewhat pushing back at us. Okay. And we just say, give us what we need. And we're not going to stop that, Trevor, not going to stop.